Good morning, and thank you for joining us for SBB Live. I am your host and the publisher of Seniors Blue Book, Amanda Barton, and I am so excited today to bring on one of our brand new partners, Tara DeMond with Iona Cannabis Clinic. How are you this morning?
I'm really good, Amanda. Thank you.
Now, you are such an amazing educator in this particular field. Give me a little bit of the history and background on what brought you into this industry, and then talk to me a little bit about Iona Cannabis Clinic itself.
Well, I've been a registered nurse for longer than I'd like to say because it would say my age. And how it kind of came about was there was a resume or an application they were looking for a medical marijuana treatment center. I thought that that was a doctor's office for nurses to go in and teach people about medical marijuana and how it helps. And with my background, with my husband being a veteran and our journey that we had with cannabis, I thought that that would be an excellent position for me. And when I applied, it ended up being a dispensary. So my first foot in the door was with a dispensary, working right at the counter with all of the patients and doing education and learning, the medical marijuana use registry and how to dispense and things like that. And then created a nonprofit organization, me and my husband, to help veterans get their cannabis card in Florida. So I left the dispensary and I was going to do the nonprofit full time. And another dispensary came along and had a position and was very open with me also having a nonprofit. So I went along with them and I was there for a few years. And my job mainly was to go around and educate physicians on how cannabis can be used as medicine. And some of these doctors were already certified to recommend, and some of them weren't. A lot of the doctors that weren't needed a lot more education on how this could benefit their patients in conjunction with the treatments that they're already giving them. So COVID happened, and there was, some shifts in the jobs and stuff. And now I am a registered nurse at the Iona Cannabis Clinic, and I am at the Bonita location of Bonita Springs, and been here for since June. But I've worked alongside Iona Cannabis Clinic since the very first day I started working in the industry. As being a rep for the dispensaries, my job was to go to the doctor's offices. So I've worked very closely with Iona and all of their staff at all of their locations throughout the state of Florida. So it was a good fit for me to kind of move over and be on the other side. A lot more patient contact, educating and things like that. And that's what I love to do.
No, that's absolutely perfect. And I know that Dr. Sonn is very lucky to have you, and I know how great you are at educating the public on what the different options that are available to them. And you probably could go on for hours about,
Yes,
uh,
I could.
yeah, yeah, but go into a brief explanation of what medical cannabis is, the benefits, how it's helping people get off of opioids with the opioid crisis that's upon us, and some of just trying to break the stigma of, the dirty word of medical marijuana or marijuana in general.
So that's a lot of questions into one, but I think I can cover it. So marijuana as medicine is, people a lot of times laugh. And I like to tell people, marijuana is my medicine, and they giggle about it. So cannabis can be used, or marijuana, whichever way you like to say it. Some people like to use both, interchangeable. But the medical benefits behind medical cannabis is, for instance, I'm seeing children with seizures their seizures are being decreased, if not going away altogether. Pediatrics, I have a patient that we've worked with that has a brain tumor, slow growing. Mom decided to go all plant-based, all natural, and is not allowing her, she has chosen for her daughter to not go on the chemotherapy and radiation, because the very first thing is going to happen is her daughter's going to lose her eyesight. So since it's slow growing, we are working with that. So going from that spectrum all the way up to geriatric patients that are suffering from tremors and Parkinson's symptoms, early onset dementia, that's close to my heart because my mom was diagnosed at 59 with Alzheimer's. So those types of patients and the medications that they can take, that's cannabis. When I say medications, I'm meaning cannabis because it is medicine. So, we've seen people with hypertension and their blood pressures came down. Now, can I go and pull a medical study like I can in any pharmaceutical stuff to say, hey, this is why Mr. Smith's blood pressure went down, or why he's not on insulin anymore, or that he's lost weight? And so there's all aspects in diagnosis, and we have a whole list of things at Iona Cannabis Clinic that we can register people under. They can come with medical records from their doctor's offices, and it just kind of gives us a baseline of where to start. Because when you're using this as medicine, it's not like I can say, take this pill this many times a day, and in 30 days, if that don't work, the doctor is going to have you take 2 of these pills. This medicine being all natural, being able to increase and decrease your milligrams by the way you feel, not by when you call your doctor and say, hey, doc, this is what's going on. And they say, oh, well, you know what? Take another one. That's doubling your dose. With us, we titrate up, we titrate down. So there's a lot of, like I said, a lot of things that you can treat your ailments with cannabis. Another thing is a lot of people have talk about the stigma is they feel that they have to smoke and get high, and that's how we're going to use this as medicine. And that's the total opposite, unless that's what you choose to do at that time. But there's different routes of administration. You can take capsules, you can put an oil underneath your tongue, you can put a transdermal patch on, you can put a topical lotion, and then there is the usual, you can smoke flower, you can do inhalations of cannabis oil. So the different routes of administration comes along with onsets and duration. So a lot of patients, they are having a panic attack right here, right now. So they need to have an inhalation product because it's going to help them within a few minutes, but that only lasts about a couple hours. So in conjunction with you're having a panic attack, what we would like to see is that someone doing an inhalation and then along with it doing a sublingual drop. Because when the inhalation wears off in those 2 hours, your sublingual drops are going to come in place, and that's going to take you 4 to 6 hours. And some patients that I talk to, if they can get, if I say 4 to 6 hours sleep, they cry. They're like, really? I can sleep more than 2 hours, or I can wake up and go back to sleep. So insomnia right there, a lot of people feel like, well, I don't have cancer and I don't have Parkinson's. I don't have any of these ailments, so I won't qualify. I hear it every day. And I was one of those people, I didn't go to war, and how could I have PTSD? So you talk with us at the office, call us. We talk to you over the phone, free consultations, and let that you do qualify. If you don't, come in and see our doctors, order medical records, and we can more than likely find something you qualify under, unless you're just 100% happy, healthy, everything's 100% perfect for you, then that's great. And I want to know what your medicine you're on,
Right.
because I want to try that out.
Well, that's a wonderful explanation. Actually perfectly said. Do you want to go into, if someone is interested in receiving their card, what are some of the like processes that they would have to go through?
So the very first thing is whenever you want to become a medical marijuana patient in the state of Florida, is to get a hold of a doctor that's certified in medical marijuana. That means that they've taken a test through the Department of Health, they're registered through the OMMU, which is the Office of Medical Marijuana Use. And normally you can Google it. The DOH does have a list of doctors on there that have taken the test, but just know that that doesn't mean that they're actively recommending at that time. So for patients, of course, call Iona Cannabis Clinic would be the first step. But if you are in an area that we're not, you would go and find a reputable doctor in the area, make an appointment. Usually when you make the appointment, they just take some general information down. And then you come to your appointment with some medical records if you have some, usually your last doctor's note that shows what you're being treated for. And we gather some information at your first visit. And during that time, we assist you with your state application. And as I tell every patient, this is the hardest and sometimes the most painful part of the whole doctor's visit is getting yourself your application to the state done properly. You can leave the E off of Avenue with your address, and they will deny that. Little things like that. So you see the doctor, get an appointment. When you come in and see us, we at our office we do assist with your card application. The once you send in your application through the state, it costs $75 for the state fee. It takes about 10 to 15 business days after that payment gets sent to the state for them to process the payment, process all the information that the doctor's office sends, and then you get an email, and the email says, uh, it says, congratulations, you've been approved. That email, we say serves as a temporary card, but some people get confused because they think it's an actual card. But you get an email, says, congratulations, you've been approved, woohoo. Then you take your driver's license and print that email out. You can go to any dispensary in the state of Florida, anywhere. If you live in Miami, you can be in the Panhandle and get medicine. If you stop by Orlando, you can get medicine. And you can do it with your driver's license and that email until you get your actual card in the mail. And it's been running about 5 to 7 business days after you get that approval email that you'll get an actual card. And if you're a resident from the state of Florida, it will pull your picture right over from your driver's license. And then it looks almost exactly like your driver's license. But if you're not a Florida resident full time, you can still get your card as long as you spend over 31 days out of the year in the state of Florida. And you have a lease that shows, that you're staying somewhere over 31 days, a utility bill, a bank statement, car registration. The state of Florida allows you to become a medical cannabis patient because we have so many people that are seasonal that come down here that are from another state and they're taking their medicine. And then when they come here, they're not legal anymore. So we don't have reciprocity from any other states, which meaning if you have your medical cannabis card in Illinois, Florida's not going to recognize that. But if you're in Florida more than 31 days out of the year, make an appointment with Iona Cannabis Clinic. We'll get you in. We'll help you because sometimes it's a nightmare to do proof of residency when you're only a seasonal resident. But yeah, within 10 to 15 business days, you would get your approval. And we have a lot of people that go back and forth and they'll call and say, hey, I'm coming back in. I'll be there in 2 weeks. Can I set an appointment? They come in and we renew all their orders. So their card, as long as they keep their card active with the state, they pay that once a year, $75. We can renew their orders at any time. They can let their orders expire. And then when they get here, we'll renew them for them.
I learn something new every time I do one of these interviews. That's fantastic to know. I was unaware of that.
Yes.
Very good information. Now, in addition to that $75 that you pay every year, how often do you need to see your doctor to get your prescription renewed?
So for the doctors, you have to see the doctor every 7 months, and that's a state requirement. So why they don't do it once a year or every 6 months, so it all kind of falls coincidentally, but it doesn't. So every 7 months, you would come in and see us at the doctor's office. One thing at Iona Cannabis Clinic is we have you come in for your initial visit. And after that, if you need to come in for any consultations in that 7 months, you come in for free, but it's not required. Some people require you to come in 30 days, 60 days. We, as an RN, I'm on the phone sometimes 7 days a week, it seems like, with patients from Iona, just giving them any type of consultation, guidance, or whatever. But Monday through Friday, when we're in the office, we have people walk in all the time. And that's what I told you is I literally had to lock the door and come around because it's anytime they need help, they reach out to us. And it's totally different than a regular doctor's office. And it's going to sound weird when I say it's a community, but when our doors are unlocked, there's people here talking, visiting, stopping by to say hi. And I always think back to myself, I never did that at my primary care physician's office. I never just walked in and said, hey, how y'all doing? Hey, when do I need to come see you again? Hey, so it's a community thing with Iona. At the Fort Myers office, it's a little bit bigger than this one. And you can sit in there and just talk to patients sometimes. And I'm not going to lie, I've done it before, be like, Well, I can sit another 15 minutes, and you learn from them. And then hopefully they learn a little from me too.
Yeah, that's awesome. And you're right, it is very much like a family environment. I am a patient of yours as well, so thankful for your services. With high anxiety myself, I know exactly what that feels like. So, wanted to ask you too. I think that there's a big misconception out there about CBD oil. Talk to us about the differences between THC and CBD oil, because I've had friends that I've recommended CBD oil to, and they're like, "Oh no, I can't do anything like that. It'll make me high," and obviously that's not the case. So talk to us about what CBD is and how it can be used as a medical treatment.
So CBD and THC are both components that are naturally derived in a cannabis plant. CBD, some people don't like you to say non-psychoactive or non-high. It doesn't make you feel that euphoric feeling when you take CBD. THC is the euphoric side of it. So people that I'll tell, first off, they'll always say, "Oh, I've tried CBD. I've tried it." And the first thing I'll say is, anything you buy over the counter that's not in a medical marijuana treatment center in Florida, it's not regulated. There's some good stuff and there's some bad stuff. I've taken some hemp derived. So that's one of the first things I think people get confused is, well, I've already done that before. Well, the CBD you're getting from the dispensaries is totally different. So a patient that comes to me and says, I want to take this as medicine, but I don't want to get high. A doctor would tell them, we want you to take CBD with a little bit of THC because you will get the optimal of the medicine, optimal benefit of the medicine without feeling that euphoric feeling. So CBD, if you think of it as it's very good with anxiety and mood stabilizer. It's very good with inflammation, and it all does all of those things without making you feel high. THC, if you put CBD and THC together, you'll sometimes, if you're a patient, you'll go to dispensary, you hear people talk about a 1-to-1 ratio. What does that mean? 1 milligram of CBD to every milligram of THC. And the reason is you create an entourage effect. So people that go out and they say, well, I take this CBD, I bought it over the counter, it doesn't have any THC in it at all. That is beneficial for some people, but for instance, like Parkinson's patients, if they're taking CBD, even with the 0.8% or less that's required in the state of Florida, they don't get the optimal benefit. Whenever I see them switch over and their doctor starts allowing them to have THC without the euphoric feeling, even high CBD with a little bit of THC, you'll start seeing their tremors subside. And, they'll start their movements and stuff are a lot better whenever the THC is added. And it just shows us that you do need both. But CBD is usually, a lot of our patients that are older, they'll do CBD products with a little THC in it. I had a guy today, he came in his golf swing. He was standing here trying to show me, look at me, look how much, and I was just amazed because when I saw him 7 months ago, he had a cane and he wanted to go golf. Well, I guess he's been golfing because he was swinging all around. So people realizing that CBD can be used as medicine without being high. THC also, if you have a high CBD with a low THC together in a tincture oil, we call those ratio products,
Yeah.
you get the optimal benefit without feeling high.
Yeah, and I want to say too, I think it's a lot of regularity as well. I'm trying to think of the right word. You can't just do it one or two times and expect to see results. It needs to be a consistency when it comes to the CBD oil. Is that right?
Yes, and that's the main thing that a lot of people think too when they think of cannabis. Well, I just do that when I need it. And I'll go to patients and I'll say, well, do you take your blood pressure pill just when you feel like you need it? If you want to use this as medicine, you got to be consistent. I prefer people doing it around the same time of the day. If I can get someone to ingest something, a tincture oil or a capsule or something one time a day, I feel like I've benefited because most people coming in, well, I smoke and I vape. Well, when you smoke and you vape, you're getting a lot of THC unless you're literally buying a 1-to-1 vape pen or a vape pen that has CBD in it. So I always say, well, it's okay. You can smoke, you can vape, but promise me this. You're going to do one thing consistent every day. Tincture, oil, capsule. Now we have edibles. Not that I feel medically that everybody should eat a cookie before they go to bed, but if that makes them to take their medicine, by golly, take that cookie. So yes, they need to ingest or mucous membranes through sublingual consistently every single day. And some people will say, I can smoke and I can vape and I can get the benefits that I need and I don't need the other stuff. And after 7 months and 7 more months, they keep telling me that, then I'm like, okay, I'll leave you alone. But if you come in and you see me on a 7 month follow up and you tell me, well, I smoke this much and I vape this much, I'm going to say, all right, here's my 10-second elevator speech. Buy one bottle of tincture oil. It's going to cost you around $75. Increase it gradually, do it until the bottle's gone. Then if you stop and you're saying, whoa, that did help. But if you stop and you're like, I really don't feel any different, then it didn't really do anything. But at least now you shut me up when you come in for your next 7 month visit.
That's awesome. I love your passion. It's what makes you so good at your job. So I just want to thank you so much for your partnership. Thank you for joining the network. And thank you for your time this morning, Taylor.